I spent a lot of time talking about the pros of buccal fat pad surgery and its removal, and how a lot of the fears about buccal fat pad removal being hollowness or gauntness or premature aging are largely unfounded. Frankly, we haven't had enough time elapsed since the surgery has become popular to really even evaluate these things. And a lot of people ask me, am I a candidate for buccal fat pad surgery? And I've made probably 2, 3, or even more videos about this in the past. I've even created little templates for people to self-evaluate whether or not they are candidates for this procedure. But there's one thing that I haven't done, and that is to truly evaluate who is not a candidate for buccal fat pad surgery. If you're interested in determining whether or not you are or are not a candidate for buccal fat pad surgery, stay tuned. Hi everybody, I'm Dr. Jonathan Zelken, a board-certified plastic surgeon in Newport Beach, California. My specialty is a lot to do with facial contouring, as well as buccal fat pad removal, and also cosmetic surgery at the breast and body. But today I want to talk about a all too common topic on my YouTube channel, which is buccal fat pad surgery and facial sculpting. A lot of people come to my clinic for buccal fat pad removal upon answering the question, am I a candidate for plastic surgery? You know, in the past, I've said everybody who has buccal fat pads and wants them out is a candidate for plastic surgery. I think it's very subjective to determine who is and who is not a candidate for plastic surgery. You can have people with big, chubby cheeks who appear to be obvious candidates for the procedure, and you can have slimmer faces for young men, for example, who want to look more sculpted. So to say one person is a candidate for the procedure and another is not only discriminatory, but it could also be unfair to the people seeking surgery. However, after performing at least 500 of these buccal fat pad removal surgeries, I can think of a few challenging cases which helps me answer the question, not who is a candidate for the operation, but who is not a candidate. And I'm going to anecdotally recall 3 patients. And these 3 patients will, in fact, guide my discussion from here on forward. Number 1. One person who is not a candidate for buccal fat pad surgery is somebody who's done something about it before. It's really challenging for patients to come into my clinic and say, I've had buccal fat pad surgery. I don't know how big the specimens were. There were no pictures. There was no data about how big they were. But my surgeon says he only took out a little bit and there's more to take out. It's really hard for me to go back and to assess whether or not a little bit is the buccal body. Is it a part of the buccal body? Is it subcutaneous fat because they just missed the 8 ball altogether? I don't know. That's an obvious person who is not a candidate for buccal fat pad removal in my clinic. I feel uncomfortable doing revisionary surgery, following patient suspicions that not enough buccal fat pad or none at all was removed when in fact they were consented and billed for that procedure. It makes it difficult. Number 2, people who have injected Kybella or tried other procedures into their buccal space. I'm not sure whether or not these patients have actually hit the buccal space and dissolved buccal fat, but doing something like that will make that fat pad, assuming you get a hole-in-one and actually hit it, will make it very scarified and difficult to try and remove this encapsulated fat pad that normally delivers itself beautifully and gratifyingly. Is that a word? In any case, people who have done things to their buccal fat pads or attempted to through clinics in the past make it very hard to do buccal fat pad removal. And so attempts at radiofrequency, minimization of a buccal fat pad or Kybella injections into that space seem sort of noble and cool, and if it works, great. But the truth is, it's unlikely to be effective. It's more likely to actually hurt you in ways that we can't control surgically. And if and when this leads to disappointment because you don't have enough reduction and you choose to do buccal fat pad removal surgery, the operation is going to be really hard. So let's lump all of that first category as prior attempts at buccal fat pad removal, surgical or non-surgical. If you fall into this category, I'm going to think twice about whether or not I am willing as a surgeon to really go in and try and take out more. Number 2, People who have had other surgery of the face, be it cheek implants, be it reconstructive surgery, and be it jaw implants, anything that will put also orthognathic surgery like BSSO or basically cutting the jaw and moving it forward or setting it back. When you do these operations, this oblique angular approach to the mandible, for example, borders on that buccal space. Also, a lot of times when you do cheek implants or you shave down a cheek, you are working in the same area. If you have trauma, you've been hit and you have a mandible angle fracture, the same approach is used to place a small titanium plate. Anytime you do that, a known nuisance / side effect of that procedure is sometimes you get into the buccal space and the buccal pad spits out and it's like in your way, and you've got to either kind of reduce it or deliver it back and close over it. In any case, you become sort of a type 1 patient where you've had previous intervention to that space. And any scarification makes this safe and easily reproducible operation a lot harder, because no longer do you have this encapsulated virgin buccal fat pad that easily delivers itself. Now it's scarified, it's tethered, and it makes it a lot harder to remove. Therefore, the safety of this procedure and the predictability kind of becomes compromised. And I would say you are a borderline candidate if you've had previous orthognathic surgery or jaw angle implant surgery or jaw fracture surgery or certain types of cheek reduction or augmentation with implants. That also puts you in a category where you may not be the best candidate for this procedure. And number 3 is probably the least fun one to talk about, which is patients with unrealistic expectations. As I have said many times in the past, the buccal fat pad removal procedure is very pleasantly conservative in terms of how easy it is to perform in many cases, but also how subtle that result is. It gives you a subtle contour in your midface that will not change things drastically. It doesn't make you gaunt, it doesn't prematurely age you, and as far as I've known in my practice, patients don't regret it in 10 years. Essentially, this is an operation that is designed to give you contour, not to necessarily slim your face. And because of that, if you are willing to accept that and understand that you're not going to look exaggerated and have a really narrow sucked in cheek appearance like a permanent duck face, then I think you're going to be more happy with the result. Patients who have realistic expectations of what would happen when you remove a 3 to 4 cc buccal fat pad, which is about the size of your thumb and soft, from deep inside your cheek are the ones who are happiest. Yes, my patients are typically very happy after this procedure, and it's typically safe. I am careful about who I select for the procedure after telling them that these are my expectations for your result and reminding them that this is not something that is easily manifest in 2 dimensions. 3-dimensional imaging is a little bit more effective at showing the net effect of this procedure, as we've discussed in prior videos. So, to summarize, type 1 patients who are not candidates for procedures are those who have had something done to manipulate the buccal fat pad in the past, either surgical or non-surgical. This will invariably lead to scarring that makes an operation that is typically gratifying and safe more challenging. Number 2, patients who have had prior orthognathic surgery, jaw trauma surgery, or cheek surgery may also have interference over the buccal space, even though that buccal fat pad was in itself directly addressed in prior procedures. That would be category number 2. Number 3 are patients with unrealistic expectations, and I'll do my best to sort that out from my end after a consultation. Very good news is that these 3 categories honestly amount to less than 2 to 3% of the patients I see who are interested in this procedure. By and large, patients who want this procedure, whether or not they have big full cheeks or not, are realistic people with good expectations. They're knowledgeable, they're young, they're healthy, and this operation is typically very satisfying to them, despite less than drastic results. If you have any questions, or you've been thinking or wondering to yourself, am I a candidate for buccal fat pad removal? Don't hesitate to contact my clinic, set up a consultation, and we can meet either virtually or in person. Also, feel free to leave your questions and comments below. Make sure you subscribe and turn your notifications on. Thank you so much.